So has the government done the right thing by introducing the rule of six in the face of rising COVID numbers? And is it right to put so much faith in an ambitious, huge testing programme? I'm joined now by Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter and an expert in infectious disease management. Thank you for joining us this morning, Dr. Pankhania. Firstly, what do you make of this rule of six?
We don't know how that number was derived, I must say. Is it 6? Is it 8? Is it 4? I think it is based on a lot of modeling, but we don't know, what the right assumptions were in the modeling. Having said, it is time we had restrictions because the case numbers are going up. But we need restrictions in other parameters as well. Hubs, the transport hubs, the offices.
So you think there'll be further restrictions in the future?
I think if we are really serious about keeping case numbers down, we have to consider all facets wherever infection is occurring or potential to occur. We should restrict it. And actually, the sooner the better, because once you have lost control, it's very difficult to regain control.
So given what was said yesterday by the Prime Minister, do you think those restrictions should have been put in place a lot earlier, a few weeks ago, perhaps?
If anything, we have said this many times that we lifted the lockdown prematurely. Having said that, we are in a position where we are. This was predicted and expected, and now we've got to sort of get a bit more serious about it, very serious, because winter is coming. We need to consider, is it really necessary to ask people to return back to their offices if they can work well from their homes? And especially the other thing is the pubs. The pubs and the restaurants are a big concern to me.
What do you make of plans to carry out 10 million tests a day?
It's a good, ambitious thing. However, again, I ask myself, why is this money not being given to the NHS to do it? Because we know that the test and trace served by Deloitte and others hasn't really been very good, and it has been shown to be failing in the last few days. So to spend another £100 billion in the private sector, who advised the government? Where is the screening people, the public health experts?
Yeah, and some scientists are warning that it could lead to an increase in false positives. Is that a concern that you have, and what is the danger of that?
Well, if you have a lot of false negatives or positives, what you have is when you are testing a lot of people, it means if you have a false positive, the size of city of Sheffield or more, you cannot do that extensive contact tracing. And remember, while Prime Minister Johnson has talked about £100 billion testing, what about the contact tracing that should follow? The two have to be connected to each other.
Do you think that the restrictions will continue till after Christmas? That is the concern now, isn't it? That people are worried that we're going to be doing this for a number of months. It's not a matter of weeks, as we heard yesterday in that news conference.
I think so. And it is better to be honest with our viewers, listeners, and say so, that this is not going away. We've had an extended lockdown, and because it was not a full, total, proper lockdown, and if we watch what has happened in Europe, we know that case numbers are going up, it will go up again, and it's better to brace ourselves for 2021.
Yeah, and in terms of looking at what has happened in Europe, I mean, at the news conference, they were clear to say that Belgium is a country that has seemed to sort of suppress the rate of infection. Do you think that is achievable now with the restrictions that have been put in place? Or, as you said earlier, do you think it's a case of we're going to inevitably have to put further restrictions now?
I think we need to have further restrictions, and we've got to grasp this painful nettle and do it, because once it has started to go up, it's so difficult to pull back.
OK, Dr. Bharat Pankhania, really good to get your thoughts. Thank you very much for your time this morning.
Good morning.